thanks for watching. I'm Dr. Elissa Hellman, a board-certified OBGYN who sees women of all ages, both in the office and via telemedicine. One of the most important conversations I can have with one of my patients is about how to optimize your health before becoming pregnant. Many women start thinking about this when they're already pregnant and realize, hey, there's a baby growing inside of me. I have to start thinking about this, and that's definitely a good thing. But focusing on providing the healthiest environment from before conception is even better. So let's jump in. One of the first things to think about is your overall nutrition. What are your eating habits? Are you getting an adequate amount of fruits and vegetables that provide those good vitamins and minerals that help make your body work efficiently and for your baby's body to grow properly? If you've been surviving on mocha lattes and candy bars and pastries over the past few years, it's time to think about incorporating more of a healthy, balanced diet. Adequate amounts of healthy fats, proteins, and carbs from whole grains and produce is what's going to give you the vitamins that you need. It's more important to focus on the balanced nutrition rather than worrying about the actual number on the scale. Everyone's body is different. Another part of healthy nutrition is taking a prenatal vitamin every day when you have plans to try and conceive. The most important vitamin in there for conception is folic acid. Folic acid has been shown in multiple studies to help decrease the risk of what's called neural tube defects. These are very serious birth defects related to the brain and spinal cord. This part of the baby forms sometimes even before you know you're pregnant, very early on in gestation. You need at least 400 micrograms a day, and most prenatal vitamins will have that amount, if not more. Other important vitamins to make sure that you're taking are calcium, vitamin D, iron, and omega-3 DHA fatty acids. Exercise is the next thing to think about. The main goal of exercise is to optimize your cardiovascular health and your musculoskeletal health. In non-medical words, that means making sure that your stamina and heart are healthy and that your muscles and bones are fit and strong. This is important because one of the most physically stressful states a woman can be in is pregnancy. Your body is doing so much, so rapidly, and being as fit as you can makes those changes easier to handle. Start slow whenever you start a new exercise regimen. And unless it includes any extreme sports with a high risk of injury, most exercises are completely fine to continue while pregnant and actually encouraged to continue as it makes your pregnancy healthier. The next thing I'd like to touch on is important for someone with a pre-existing medical condition. This means that you have a diagnosis that requires either management with medication or being followed by a doctor who is closely monitoring the negative effects and symptoms of the condition to make sure that they are controlled. Common ones include high blood pressure, diabetes, asthma, and autoimmune diseases. When you are thinking of becoming pregnant, it's important to make an appointment with that doctor who's helping manage it before becoming pregnant. This gives an opportunity to make sure that the condition itself is tightly controlled. They may want to order some blood or urine tests and imaging studies to make sure that the condition itself is optimized. If anything looks abnormal, it gives an opportunity to be able to try and fix it before pregnancy is achieved. If you are taking any medications to help control the condition, run them by your doctor and just make sure that they're safe in pregnancy. If they aren't, it will be very important before becoming pregnant to switch over to a treatment that is safer. It also will give you a few months to see if that new treatment is just as effective for controlling the symptoms of your condition. And let's not forget mental health concerns. Pregnancy is an emotional and stressful time in someone's life. Depression can develop and anxiety can worsen. If you already have some of these concerns, make sure you make an appointment with your mental health provider so that they can help you feel your best before conception. It's also very important to continue seeing them during a pregnancy, as it is in a very rapidly changing time in your life. The next few points I'd like to make in the discussion of optimizing your health for pregnancy is about arming yourself with information that can help make the process of conceiving easier and keep you more informed of your own risks. Genetic carrier screening is something that Jews have been doing for a very long time. It is a blood test or saliva test that lets us know if deep in your genetic makeup you carry an abnormal gene that can be passed on to your children. If your partner has the same abnormal gene and passes it on at the same time, there is a chance that your children could have a serious condition. If you are a carrier for an abnormal gene and your partner is not, it usually does not matter and should not affect your children. There are many organizations that offer testing. I usually recommend labs that test for a very broad and inclusive range of conditions and let you know the specifics of your results. If both you and your partner are carriers for the same abnormal gene, it may be possible to use reproductive technology to ensure that your children are not born with a devastating condition. Probably the most important thing you can learn about your health and your body before becoming pregnant is your fertility. Understanding when in your menstrual cycle achieving a pregnancy would be possible is one of the first steps to learn before trying. When thinking about getting pregnant, one of the most important things to know is when you are ovulating. Ovulation is the time every month when your ovary releases an egg that potentially could become fertilized and start to form into an embryo. When a woman knows her pattern of ovulation and that it is happening regularly, it is pretty simple to know when to try. Now, not every woman gets pregnant every month that she tries, but if everything is working properly, it should happen eventually. If you start to see consistent irregularities in your menstrual or ovulatory patterns, this is a reason to go to your doctor to make sure that everything is okay, when to be concerned, and when it may be helpful to see an infertility specialist. You don't need to already have difficulty conceiving to see an infertility doctor. They are there to help guide you if a potential problem can be identified before even trying. This can help you feel more in control of potential infertility situations that may be very scary and frustrating. Remember, pregnancy is not a disease. It is a normal physiologic state that most women find themselves in at some point in their lives. Yes, there are risks involved, just like anything we go through. But by taking care of your health and arming yourself with information about your fertility and genetics can help you achieve a happy and healthy pregnancy. Thanks for watching.